Good afternoon. Welcome, everyone. I see everyone's logging in, so we will give everyone just a couple minutes before we go ahead and get started. Thank you all for being here.
Okay, welcome to our FCI monthly seminar series. If you're just joining and trickling in, we'll be reviewing today our accomplishments in year 9 of the Firefighter Cancer Initiative. So please feel free to settle in, adjust your volumes, and we'll get started in just a minute as we allow other folks to sign in. Okay, why don't we go ahead and get started? So first of all, good afternoon, wherever you're joining. If it's East Coast or West Coast, you're tuning in to our Firefighter Cancer Initiative monthly seminar series. This month culminates with the 10th year anniversary of our Firefighter Cancer Initiative. And so on behalf of our leadership, Dr. Aaron Kobitz, all of our investigators and all of our firefighters and collaborators, we thank you for this amazing accomplishment. The goal that we want to set for this particular monthly initiative is to take a look back at what is going to be a decade's worth of research that has been accomplished through the Firefighter Cancer Initiative. Specifically, in this session, we're going to look back at the last 12 months to explore across all the different programs of the Firefighter Cancer Initiative what research projects have been done and have been completed. So I'm going to pass the torch on to my colleague, Dr. Natasha Schaefer-Sali, who will provide us with the initial overview of FCI's accomplishments. Dr. Sali.
Yep. Thank you, Dr. Kaban. Thank you, everyone, for joining us. So we're really excited, as Dr. Kaban mentioned, to kick off our year 10. And so with that, we're going to share with you what we've accomplished in this last year in year 9. And many thanks to our firefighter partners, the State Fire Marshal's Office, who, without our partnership and collaboration on really every aspect of our research and our outreach and our education, none of this would be possible. So just to give you a quick overview of what we've done since the beginning, you know, at the end of this year, we've engaged over 22,000 firefighters, whether that be through our research, our education, our clinical care. And we've really been able to touch firefighters from not only the state of Florida, but nationally and internationally. We currently have 24 active research projects. In addition to our research projects, as I mentioned, we do provide clinical care. And since the initiation of the Firefighter Cancer Initiative, we've been able to screen over 1,000 firefighters for several different types of cancers. In addition, we've been able to assess cancer screening behaviors, either through surveys or being part of one of our active cohorts for over 12,000 firefighters, and to really have a better understanding. So there you can see some pictures of some highlights from this year that we're going to go into more detail. We're going to break it down by program. But just as you can see our International Firefighter Cancer Symposium. That was a huge success this year. Our women's seminar series that started, working with our wildland firefighters, as well as our fire trainers, and collecting some aerosol samples and breath samples from our fire trainers. So I'm going to start us off and go over some of the accomplishments for our leadership program. So our leadership program is really in charge of the events and the education that we do for our firefighters. So we hosted our 6th annual International Firefighter Cancer Symposium. This year we had a record attendance of over 1,300 attendees, both in person and online. Again, having a really big footmark internationally. So not only here in Florida or the US, we also had attendees from Canada, from Australia, Mexico, really all over Europe signing in and listening to the science that was being presented. We've been able to successfully present monthly seminar series, just like we're doing right now, and having really high attendance from not only our firefighter partners, but also other partners in academia. We've been able to create and distribute monthly newsletters and social media posts. And then this year, we really had a great opportunity to create the inaugural Torches Fellowship, where we selected 3 firefighters who have partnered with scientists here at the FCI to create their own research projects. And so that is ongoing. We're about halfway through. Our firefighters are creating their protocols and will be gearing up to start collecting data with the goal of presenting their work at the 7th Annual International Firefighter Cancer Symposium in 2025. This year, we've also created a national advisory board. So every year, we've always had advisory boards and getting feedback from firefighters at a local level. And, as we've grown, we thought it was really critical to make sure that we included partners from a national level. So including leadership from the IFF, the National Volunteer Fire Council, as well as other organizations throughout the country, including the Firefighter Cancer Support Network, the Florida Firefighter Safety and Health Collaborative, all to be a part of this advisory board to give us input as we create new protocols and get feedback on ongoing projects that we've been doing. And lastly is our investigators. Our investigators have been really productive this year, not only creating and publishing scientific manuscripts, but presenting our work both nationally and internationally at either firefighter conferences or scientific conferences. Moving on to our second program, which is our cancer screening, education, and survivorship. There you can see some of the photos of some of the education materials that we've created, including our cancer screening passport, which gives recommendations of cancer screenings for our firefighters and at what age they should be getting screened, that they can keep themselves and share with their doctors, as well as some educational posters that will be shared within our physical toolkit that you can see there that we will be working on distributing this year in 2025. So we also have created new modules for our FCI curriculum that really focused on our firefighter subgroups. So some of the feedback we received was making sure that we included education for our wildland and our fire trainers and our fire investigators. So those modules have been added to the curriculum. And we've enrolled 237 participants into from the state of Florida into our education curriculum and evaluation this year, which covered 18 different departments across the state of Florida. We also were able to present a poster on our evaluation of the green decontamination buckets among Florida firefighters this year at the Firefighter Cancer Symposium. And then implementation of our FCI mobile toolkit. So that was created the year prior, and we've continued to market and share it. And so at this point, we're at over 600 downloads at a national level and distributing that. And then, as I mentioned there, you can see our physical toolkit that we've been working on putting different education materials and supplies that we'll be working with now this year to share with health and safety officers at local departments statewide. Yeah, another study that was part of our program was our nutrition study. We've currently enrolled 207 participants across the US, including 19 states representing. And just some of the preliminary work, we've been looking at the carotenoid scores. As you can see a picture there of us looking at the nutrition and chrono score of a firefighter, and also looking at physical activity. The other thing with our program is our survivorship. So we've currently actively going through the intervention with our 4th cancer survivorship intervention group and actively recruiting for our 5th group. So we are just a couple participants shy of completing that group. So we'll be able to start our 5th group. Lastly, for this program is our women's cohort. So something that we've really strived to grow is the learning more about our women firefighters and their risk for cancer, as well as other concerns that they have brought up related to fertility and hormone change. So we've currently enrolled 130 Florida firefighters that we'll be following over time. We also implemented the Women in the Fire Service Educational Seminar, where we have gone to 4 different departments, including Coral Springs, Miami-Dade, Jacksonville, and just yesterday, Pasco County. It's a really great event that we're able to share the latest research and literature on women in the fire service with our women firefighters and giving them the opportunity to enroll into our cohort. Next is our FCI Wellness and Cancer Prevention Clinic. As many of you know of our clinic, that we were able to receive funds to create a mobile vehicle that we've been able to furnish as a clinic and contract with local departments to then provide annual physicals and refer our firefighters for cancer screenings. So this year we were able to deploy our 2nd mobile vehicle. So we have now 2 active vans that are going out and providing physicals for our firefighters, with a total of 3 completed departments. And in this year alone, we've screened over 425 firefighters for multiple cancers. I'll now hand it off to Dr. Kaban for our occupational, environmental, and carcinogen exposure.
So I'm happy to take the baton on from Dr. Sali and remind our attendees that if you have questions or comments, please make sure you pop them into the Q&A option within our Zoom session. So I'm proud to share our accomplishments for this year for our occupational, environmental, and carcinogen exposure program. So one of the unique cohorts that we have unique to the state of Florida is what we call the fire cohort. This is a group of fire departments that are representative of fire departments across the state of Florida. And each year we augment the number of participants across the fire departments that are eligible to participate in fire. Fire is just like the annual cancer survey that was established by the FCI back in 2015, but allows us to create a state-based representative sample of fire departments. This year, we enrolled just slightly over 100 Florida firefighters into the fire cohort. A second cohort maintained by the FCI is what's called the aerial cohort, and these are retirees. You all will remember that back in 2016, our retired firefighters were asking if they could participate in the research being conducted by FCI. And really, it is in the time period of retirement and later stages in life when we start to begin issues around cancer risk and cancer diagnosis. So therefore, the aerial cohort, since it's been established in 2016, continues to be the leader nationally on the enrollment and recruitment of retired firefighters who are followed year after year for cancer risk and cancer diagnosis. This year, we enrolled 76 retired firefighters into the cohort. A third resource that's conducted and maintained through the Firefighter Cancer Initiative is a dedicated firefighter tumor bank. This is a biorepository where any firefighter in the United States that's diagnosed with cancer can deposit their tumor into the repository for use by other research scientists. So this year we set a goal of collecting 10 tumors, and that's exactly what we enrolled this year, 10 firefighter samples into it. The tumor bank has been an incredibly valuable resource. This year, we pilot tested a new methodology with our colleagues from the Department of Biochemistry to be able to test the tissues for the presence of metals, giving us some insight into what metals and metalloids are present in the tumor samples collected from our firefighters. In this program, we also paired up with our colleagues from the College of Engineering, Dr. Pritam Biswas, and Shruti, to be able to measure aerosols that are coming off firefighter gear. So we paired off with 3 fire departments who collaborated with us in the measurement of aerosols or particles that come off the gear from firefighters after they've completed a fire suppression activity. and are able to document the impact of those emissions on the gear, as well as on cleaning procedures. We partnered with our medical oncologist, Dr. Justin Taylor, to look at early changes in blood cells in firefighters, particularly for our liquid cancers like leukemia, where we're interested in seeing if we can detect early changes that would lead to the development of these types of liquid cancers. We call that CHIP for short, and we're really looking for clonal mutations that happen in the blood. And so Dr. Taylor was able to process some additional samples of firefighter blood to look for these specific types of clonal mutations. So stay tuned, as he'll have more information that was similarly presented at the symposium earlier this year. And lastly, we just completed our PFAS feasibility study. This is a national study evaluating perfluoroalkyl substances in the blood of firefighters. We initially conducted a feasibility and acceptability pilot study to learn whether or not postal mailing at-home tests for PFAS was a suitable approach to evaluating the blood of firefighters for PFAS. We then subsequently used that data to be able to document what type and concentrations of PFAS we see in the blood of firefighters. We most recently had 3 scientific abstracts accepted to the American Public Health Association, where we'll be looking at some of the results here from the PFAS study. Specifically, we've been evaluating how second jobs of firefighters might impact PFAS results. We've been looking at military experience having the war theater. Are their PFAS levels different than those who have never been to a military theater? And also, we've been looking at our women firefighters and evaluating how the menstruation process might impact serum blood PFAS levels. So if you want to know the results, I encourage you to visit the American Public Health website for the 2024 meeting, which took place in Minnesota, where we'll be sharing those results accomplished here in this program. Next slide. So our next pillar and key program within the Firefighter Cancer Initiative is what we call the Cancer Epidemiologic Surveillance Program. And this is really a dedicated firefighter cancer registry. This is a unique resource here to the state of Florida, thanks to our state fire marshal and our state legislator, that allows us to dedicate effort and time to utilizing the existing cancer registry for the state and learn about what are the cancers that are being diagnosed within our firefighters. So this year, the Cancer Epidemiologic Surveillance Team, led by Dr. David Lee and Tulay Koro-Singal, submitted 8 scientific manuscripts looking at various issues around new cancer cases or deaths among firefighters due to cancer. They had 2 presentations, most recently at the Cancer Registries Conference, looking at the long-term impact of using a policy around restrictive tobacco use and cancer in Florida firefighters. And also looking at skin melanoma. As you know, when we started FCI almost 10 years ago, one of the early cancers we identified at elevated risk is skin cancer among our firefighters, and we continue to evaluate that using the cancer registry. Specifically in this presentation, we were evaluating survival, the ability, of how long you live once you've been diagnosed with an aggressive form of skin cancer like melanoma. This team also recently presented looking at cancer risk and mortality among firefighters, conducting a analysis that's available for download directly on PubMed. And again, as mentioned, we've been looking also at non-causes of death among firefighters compared to cancer risk, doing meta-analysis and tobacco in these firefighters. Next slide. Okay, let's spend a few minutes just going over some of the ones that were just recently published. So this is literally hot off the press, released last month in June. This is an analysis focused particularly on our Florida volunteer firefighters. So volunteers actually make up the bulk of the fire service workforce, which is around 65% of 1.1 million. So there's a lot of interest in being able to dedicate research to our volunteer firefighter workforce. In this analysis, we identified volunteer firefighters in the state of Florida and did a case control study to evaluate what are the odds of developing cancer between those male and female volunteer firefighters. And what we found was that volunteer firefighters are an increased odds of being diagnosed with prostate and overall male genital cancers, while the female volunteer firefighters were at an increased odds of developing kidney cancer. Next slide. Another analysis of the 8 that were completed this year that we're happy to share with you was conducted by our own Dr. Paulo Pinero, where he was looking at prostate cancer survival among our Florida firefighters. So he basically did a retrospective review using the cancer registry to look at survival, the length of time that it takes before an event to happen. And he was able to conclude that firefighters experience enhanced prostate cancer survival, particularly in cases when the diagnosis is localized at a particular stage, likely due to increased PSA testing. So hopefully this contributes now and another piece of regarding prostate cancer, a cancer we see elevated in our firefighter workforce. Another analysis by this research team was specifically looking at lung cancer survival. This was led by our own Dr. Tulay Koro Singal and this team. This is the first peer-reviewed article that's looking at survival experience for firefighters that are diagnosed with lung cancer, and then comparing them to other worker groups in the state that were also diagnosed with lung cancer. They ultimately concluded from this analysis that male firefighters with lung cancer tended to have longer survival times than those compared to white collar, blue collar, and service occupations, which can be due to many different types of factors, but thankfully they have longer survival times when compared to other occupational groups in the state. Another manuscript was a methodological paper, and this one's really interesting because not only is the registry contributing to our knowledge base on specific types of cancers, but also advancing and innovating in the space of new methods to be able to analyze issues within cancer studies. So this was led by our own Dr. Soyan An from the School of Education and Human Development, looking at using a different methodological approach when working with registry data. They were able to identify challenges in how one looks at effect size, basically the way that we measure specifics of error within analyses and meta-analyses, especially longitudinally over time. So really this article is providing some really practical guidelines on how to handle challenges that occur or happen when analyzing occupational cancer literature. Another paper by Dr. Soyan was evaluating the psychometric properties of assessment tools, basically like questionnaires that are used when meta-analysis. This data was informed by our previous meta-analysis by the team that's using a more sophisticated methodology to look at the scales and the measures that are being used in observational studies for cancer. Okay, I'm happy to report on an additional component of our Firefighter Cancer registry, which is our personal exposure reporting. This is led by our colleague, Dr. Barbara Malay from the School of Communication. So in this past 12 months, she's enhanced the maintenance of the PER by adding new fields and expanded data options to improve the way that the PER is maintaining the security of the data that's collected from our firefighters when they report in their individual incidents. She also just completed a manuscript that was dedicated to our airport rescue firefighter personnel, which is currently under consideration under the Journal of Occupational and Environmental Medicine. So cross fingers for a favorable review. In this last 12 months, she's also been able to enhance our fire inspectors exposure tracking process. So she's conducted interviews with fire inspectors from various Florida agencies to be able to look at risk factors like hazards and PPE usage among our fire inspectors. And this is really key to making sure that we have accurate measures that are being collected in the personal exposure record app for you. So if you're a firefighter and are interested in using this tool within your fire department or just personally, please do reach out to Dr. Malay, who's a wealth of information in this space and helping us organize these exposures, self-reported exposures from different firefighter subgroups. Okay, I'm also very proud to switch gears and present on behalf of our biochemistry team, which leads our environmental sampling program. This is sort of our industrial hygiene program within Firefighter Cancer Initiative, and it certainly has been a productive 12 months. The biochemistry team has been looking at documenting aromatic hydrocarbon exposures in wildland firefighters, specifically during prescribed burns. As it turns out, we have lots of forests here in the state of Florida, and have been working with our forestry leadership and collaborators on evaluating those exposures that our wildland firefighters encounter during prescribed burns. That paper was just recently released and is available in PubMed. The team has also been measuring perfluoroalkylated substances, or the forever exposures that are coming out of turnout gear, using methodology for swabbing off of the gear, been able to detect certain PFASs that are coming off of it. The biochemistry team has also been supporting Dr. Salih's research on looking at PAH exposure and accumulation within the vaginal vault of our women firefighters. This is part of our women's cohort study, so that we can learn a little bit more about how PAHs affect women's cancer development. In addition, the biochemistry team has been developing some sensors to be able to measure and track carcinogen exposures that are encountered during training exercise by structural firefighters. And lastly, they've been also collecting breath and urine samples that are being evaluated for different carcinogenic exposures. Next slide. So some of the papers that have been recently published, on the bottom left, you'll see that Dr. Donner, along with Dr. Umar Bakali, have completed a manuscript using silicone-based wristbands to evaluate PAH exposures with our fire investigators. This is much thanks to Jeff Polly and other leaders in the International Association of Arson Investigators, who have been really key to helping us support them in the documentation of these carcinogens that they encounter during fire investigations. And we'll have some hopefully very positive news to share with this group next month regarding our fire investigators and year 10. Another manuscript that was also published, led by our student Umar Bakali, who's now Dr. Umar Bakali, is looking at exhaled breath analysis for evaluating occupational environmental exposures. This was just published in Trends in Analytical Chemistry. Next slide. So here's some illustrations and images of some of the work that's being done by the biochemistry team in the past 12 months. On the left, you can see heat maps where we're looking at different samples of polyaromatic hydrocarbons that were collected from wildland firefighters pre-fire and post-fire. Each column represents a type of PAH encountered by the wildland firefighter, and each row represents an individual firefighter that wore wristbands. And you can look at variations in the concentrations of these PAHs based on before the fire and after the fire. And in the center diagram, you see a couple of different illustrations. On the top left is a heat map describing the forever chemicals that were assessed in the firefighter environment, picked up from the turnout gear that was used to evaluate for the presence or absence of some of these PFAS. On the bottom, the biochemistry team has been looking at different semi-volatile contaminants that are present in the vaginal swabs. And over on the right, you see the development of a sensor to allow for tracking of carcinogens using a rover when in a different training exercise and fire environment. So I'll pass the baton now back over to my colleague, Dr. Salih, for our year 10 goals.
Thank you, Dr. Kaban. So as you can see, we've got some photos here, some of our plans. So we will continue to have our annual International Firefighter Cancer Symposium. We're also working this year with firefighters in the Northwest and the Panhandle to create a volunteer firefighter research summit day. Our clinic will continue to grow as we provide more services for new departments. We're also looking to expand our education for our clinicians and other providers in the community, for them to learn more about cancer risk in the fire service, in order to enhance their screenings for our firefighters, so they're aware of their risk. As well as increase our footprint, as I mentioned, with our women firefighters. So we continue to have our women's seminar series. We do have plans to meet in Orlando as well as the West Coast. So that will continue to happen. We're also looking to increase our care and resources in more of rural settings for our firefighters, whether it be in Monroe County or other areas throughout the state. You see a picture there of Dr. Caban and our staff members in front of a San Antonio fire truck. So that is for a reason. So we have started partnering with San Antonio Fire as well as Mays Cancer Institute. And so we would like to continue that partnership to work together in collecting data, as well as continuing to work with other NCI designated cancer centers to create new research projects. And then finally, as you see, our biochemistry team and the rover continue to make changes and additions to the rover and other aspects of collecting data in the cold and warm zone for exposure, and not only in training environments, but in other subgroups as well. I'm trying to see anything else. One of the things that we are getting geared up for and why we're a little busy this week is we are all heading, a majority of our team is heading to Ocala, Florida, to the State Fire College. We will be conducting an electrical vehicle fire, where we will be collecting not only biomonitoring of the firefighters who will be fighting that EV fire, including blood, urine, saliva, and toenails to look at exposure, but we will also be collecting environmental exposures, including aerosols, water, soil, and I think that is about it. There's a lot going on, but we were really excited, and we should be able to get a lot of data, and it's something that's really at the forefront of the research with electrical vehicle fires, and something that's a very big concern for our firefighters. With that, Dr. Kwan, anything else I'm missing? I know we have a lot of things on the plate and a lot of goals for year 10. So, those are just some of the main highlights that we're looking to share. And luckily we have all of our other investigators from FCI online. So if anyone wants to add anything in the chat that we may have forgot from your team, please do share. We'll be happy to share that. And now I open it up for questions.
So if you have any comments or feedback or questions you'd like to ask, feel free to pop them into the Q&A. We're happy to address them. Okay, so this session is recorded and we will make it available online shortly after what it is there. So we have one question that's being asked. Please feel, so if you're interested in collaborating on any of the research that you heard of today, please do feel free to reach out to Dr. Sally or I. We'll pop our email addresses in the chat here so that you can feel free to reach out and express interest in any type of particular project that we can assist with. And yes, we are incredibly thankful to our firefighter partners who make this magic and research happen. So Dr. Sala, we have one question here regarding the screening happening on the mobile vehicle.
Yeah,
so the
so
question, yeah, sorry, go ahead.
I got it. So yeah, the question was, is it only for screening or other tasks being done as well? So right now we are doing annual physicals and then screening for cancers and then referring for other cancers, obviously that cannot be done on the vehicle. So that's where we are right now. We're also, we have the opportunity to enroll firefighters in some of our active projects when they're there on the vehicle. But at this point, that's what it's limited to right now.
Okay, and then we have another question here regarding linkage between firefighters and aggressive Parkinson's disease. Is any one of you working on this? So the primary focus of the Firefighter Cancer Initiative is to look at cancer risk and cancer burden in the fire service. We are not necessarily focused on Parkinson's disease, which would fall under more of a neurological condition, but we're always interested in holistically in the health and safety of all firefighters, as many different risk factors impact cancer outcomes. So if you're interested, I'd be interested in learning a little bit more about your thoughts on Parkinson's disease, Leah. So if you wouldn't mind shooting us an email so we could talk offline and learn about what concern you're interested in doing so. We have other researchers here on campus that are working on Parkinson's disease and are very happy to connect you with them.
And then I see the next question. Is it only a presentation or is there a paper published for the PFAS mail-in protocol feasibility? Great question. So right now, they're only the presentations that are APHA, but we are working on a protocol paper right now on the feasibility of the PFAS mail-in project. So we will share in our monthly newsletters or on social media once it's published.
Yeah, absolutely. Oh, there's a fire underneath of me to publish that a couple of different papers under the PFAS mail-in protocol so that others can use it. So we're certainly, that's on our front burner. We have another couple of different questions and comments here. So the International Firefighter Safety Institute has developed, the Illinois Firefighter Safety Institute has developed an online chemical exposure and cardio risk reduction course. Yeah, absolutely. With your permission, we're happy to take this link and include it as part of the shared resources for firefighters to use. As it's really important. So thank you, Dr. Masood. So I'm just going to copy this link to make sure I have it and don't lose and don't lose it. Okay, we have another question. Do you have papers on the rover where you can read more about it? The biochemistry team has not yet completed the rover manuscript, but as soon as it's available, it'll be published and included on our website, so others know and are aware of it. In the past, any test series have been conducted on Navy ship fires or marine fires or on a marine vessel? Okay, interesting question. So let me just repeat it out loud. So in the past, have any tests or research been conducted on Navy fire ships, marine fires, or marine vessels? So to my knowledge, there are some studies that have looked at US Navy exposures. We do collect data as part of some of our research studies regarding military background and history. As was just mentioned in PFAS, we do take note of participation in wars and which particular wars and length of time in deployment within the theater. Now on the marine, off the top of my head, for firefighters, have not seen a study that has looked at firefighters with marine experience. But if you email me, I'd love to learn a little bit more about your specific questions so that we can explore and see what you're trying to understand about marine exposures and cancer.
I will say the only thing we do have with marine or water rescue or water fires is in our PER app, our personal exposure reporting. There is a question there regarding the type of incident. So if you are someone that works on the water and you want to have a place to make sure you're reporting that and keeping track of that, you can use the PER app. That there is a field for water rescue and marine fires. And then I see the last question is, how can I get more information for the mobile screening vehicle for my department, which is Brevard County? Is it feasible to possibly set up for my department in Central Florida, or is the program localized to South Florida? So far we've only been working with South Florida, but I think that we can discuss. I think if you send your contact information, I can put you in touch with our clinic operations team to discuss the questions you have related to screening.
Okay, and I think we've reached the end of all the questions. Again, we're very thankful for your time and being able to share with you the goal, what we've accomplished these last 12 months. And we kick off this month, the 10th year of the Firefighter Cancer Initiative. We have a robust seminar series planned for you, which thanks very much to Wendy, our administrative manager, have organized those listings, and you can find everything on our dedicated Firefighter Cancer Initiative website. We wish you all a wonderful afternoon and see you all next month in August for our first scientific presentation.
Thank you, everyone. Have a good day.
Bye.